Hi, welcome to Portage County Matters. I'm Patty Dreier, Portage County Executive. My guest today is Scott Rifleman, our coroner here in Portage County. I'm really, it will be an interesting show, I promise you. Beforehand, I'd like to get to a couple of news notes, like the reason I'm holding a teddy bear on my lap. No, it's not story time, Portage County. This is about our foster care initiative in Portage County. We just had hosted last week 80 people on 2 busloads of folks that had participated on our Journey Home effort. It's a partnership with Jockey International company as well as Portage County and a coalition for youth and families. And anyway, we had these 80 folks go through the steps in the child welfare process, from removing a child from an unsafe, unhealthy situation at home, all the way through the health medical system, the justice system, the social work system, and so on, to hopefully be reunited with a family in a safe situation, hopefully with their birth parents again. And learning more about that process enlightened us all about the need for more foster families, foster homes, in Portage County. We have about 90 children in Portage County right now in foster care or in on the edge of needing foster care. And so anyway, we hope that if you're interested in learning more about becoming a foster home for us in Portage County, that you will feel free to give us a call, and we'll give you information, work through the process, and see if it's right for you and right for the county and right for the kids all at once. So anyway, again, thanks to our foster bear. We've got this up in the Portage County Executive's office for just keeping that message alive this month. Thank you. Related to other news, the Portage County Healthcare Center is in the news again. I wanted to follow up on last month's news related to the progress on planning forward for the healthcare center. At this May's committee meeting of the Portage County Healthcare Center Committee, the group decided that they would develop a resolution that will be coming before the county board very soon here, that would seek to hire the help of a healthcare center business consultant to assist us with some business modeling for the center. We have some decisions to make related to the future of the healthcare center, in the way of, do we continue to renovate a building that we've been in since 1931? Or do we look at a new construction? There are different scales and business models, and the size of staff in various kinds of situations, the best care, how Medicare and Medicaid funding's changing. There are many dynamics in the healthcare center world, so we want to make sure that we make the right decision for the future of this really important mission that we have here to provide services in and across the county for those in the most vulnerable time of their life. Brian Shanick is an individual that we have called on for some other strategic planning assistance, and I just referred to some other parts of his presentation that he made to our strategic planning group in the past, and it reminds us all there are 46 licensed county homes in the state of Wisconsin in 35 different counties. 46 county homes, and Portage County is one of those, in 35 counties in Wisconsin. And at this time, according to Brian Shanick, he's the Financial Services Director of the Wisconsin Association of Homes and Services for the Aging, that more counties are building smaller nursing homes, creating more private rooms, renovating facilities, converting nursing home space and into things like community-based residential facilities or assisted living facilities. There's all sorts of ways that the original nursing homes had gotten repurposed. Anyway, other counties have been dealing with the very same kinds of issues. We're at this level now of our strategic planning for ensuring the future of this important nursing home capacity in Portage County, and I'm really looking forward to moving through the process with the help of a business consultant, so that by the end of the year, I believe, we'll have many more folks that are informed about what our choices really truly are and what best business model to choose for us going forward. So it's good news. All of it's good news for Portage County. On another news note, I had just signed this week the historic paperwork, right? It's 40 years in the making, and you know what I'm going to say after this? It's the Unified Communications Center for our county, our unified dispatch, our ability to receive now calls as of August 4th, which will be the changeover date. And we're moving in that direction to make it happen smoothly across the land here, so that all of the 911 calls, whether you're in the city of Stevens Point or in the countryside or the village of Plover, no matter what, your 911 calls will all come to a single place in the county. As an additional benefit to this initiative, we have formalized an operations group of stakeholders of the communication system, the public safety communication system, and they're already working on other important issues like our simulcast capital project, a $7 million initiative to improve our cell and radio kinds of capacities across the county. So lots happening there. My sincere welcome in advance to the official changeover for all of the 8 dispatchers in the city who will come over and join the county team. We're so honored and privileged to have you join us and to bring your expertise and enhance our team. And at the same time, my real respect and appreciation goes out to Chief Deputy Contost, who has been working to spearhead the technical side from at least the county standpoint of how to bring about this change, and working through my office since December and with the city stakeholders, with finance members on both sides, with human resource members on both sides, the sheriff, the county board, and everybody else involved. Thank you very much. I think this is a huge move, an important move for our county, and our county will be safer for it on all sides of that equation. Strategic planning, thanks for your input. I've received all sorts of different inputs to the process. I'm now integrating that into a final draft plan that I will roll out to the county board in June. That'll be on June 18th. And a final draft will be posted on the web before that meeting, so by June 11th, you'll be able to access an electronic copy, or you can call my office for information about how to review that plan. And as you know, any good plan is only as great as the people who keep it alive and who keep it in helping to carry out the direction of that plan. And so this will not be a plan that collects dust, I promise you. We will be having a regular reporting mechanism to the county board and community on the progress of the various initiatives that are part of that strategic plan, with those 4 strategic goals around economic development, around information systems and processes that the county government uses, around physical space planning, and around human capital and the personnel aspect that it takes from the county side of things to ensure that we've got the strong team we need to roll out and to continue to support really sophisticated programs and these in these changing times of policy and other initiatives that continue to be passed along to us from our state government and federal government. So besides that, I just wanted to offer you a couple of news notes related to the volunteer report I provided to the county board this week, and then we'll get on with our awesome guest today, Scott Rifleman. As you know, Portage County has a well-developed volunteer program, and I'm talking about Portage County government's volunteer program. For you know, there's also a very sophisticated program of volunteering that folks can access in our community through our volunteer center at United Way, as well as through various organizations, faith-based groups, and so on. But here in Portage County government, we have now got our volunteer policy for its 3rd year now in service. And as part of our new volunteer policy and our new way to centralize volunteering and volunteer management in our county, I am required, the county executive is required to give an annual report. So I was really honored to be able to stand before the county board this week and present that report that tells us that we have 1,192 volunteers who have assisted Portage County government in 16 different departments, for the county executive department is one of those that is assisted by volunteers, and it helps us with all of our respective missions, giving 61,724 hours of service, and using the volunteer calculators, the monetary calculators. That's a value of $1.366 million to our county. So imagine, without the dedicated support of volunteers, that in order to keep those missions alive across those departments with over 61,000 hours of work, that we would have to look at doing things differently, and certainly some of those hours would need to be covered by tax dollars. And again, we know that the monetary support, the monetary conversion is not telling anywhere close to the full story of the value of volunteering, not only to those served through volunteer programs, like those who are having their meals served to them from a volunteer at the healthcare center because those individuals can't feed themselves, or having a meal delivered to their door, or having roadsides cleaner because volunteers do the litter pickup, or helping in our parks so that we have awesome mountain biking or disc golf courses that folks can use. But beyond that, volunteering helps volunteers themselves live a healthier, happier, longer life. And Jeff Jester, the director of our RSVP program at the Aging and Disability Resource Center, highlighted some of those other health benefits, that 100 hours of volunteering in a year is like the sweet spot, the magic number to get those extra benefits of volunteering. If you are interested in stepping up to volunteer, or to expand your volunteering involvement to include us here in Portage County government, we are interested in hearing from you, and you can contact my office. We'll get you connected with the right means and opportunity to do so. With that, I am so excited to welcome you here. Scott, thank you for joining me and joining us as Portage County viewers all watching this program. The coroner's role is a really amazing role, and we're just happy to have you here.
Well, thank you for the opportunity, and I didn't bring my teddy bear.
Yeah, and I imagine you might need one every now and then.
Every now and then.
I am sure your job isn't an easy one, and I'd like to start out by just having you share with everybody a little bit about the roles and responsibilities of being a coroner in a county, and then what's your life like in that process, because I think that's something many of us are curious about.
Well, the role in state statutes for a coroner medical examiner are really to determine cause and manner of death in a county structure. And that's what we do here in Portage County also. We follow the state statutes of required death investigations. And that's the responsibility that we share. Obviously, in Portage County, I personalize a little bit more. I believe not only in our function of trying to determine a cause and manner of death. I think it's extremely important to deal with families. They're the survivors. They're the ones that truly need answers. And it's some of the rewards I receive by helping family members, by helping them through the worst time of their lives at that particular moment.
So I'm just figuring, Scott, you know, I'm imagining you as an 8-year-old, and someone says, Scott.
You have to think back a while.
Yeah, no kidding, me too. Scott, what would you like to be when you grew up? I'm pretty sure you didn't say coroner, or did you?
No, I didn't. I knew I wanted to go into the healthcare profession in some way, shape, or manner, and I did. I was in college heading towards the healthcare profession, and actually went into the Stevens Point Fire Department, began working as a paramedic EMT, and so as I was doing that, the coroner that had been in office resigned midterm, and so it became a gubernatorial appointment. So Governor Dreyfus at that time contacted me and asked, gee, would you want to be coroner? I said, gee, I'm not sure. So after a little bit of investigation on my side, I thought, you know, this might be an interesting thing to do for a period of time. And it has been a longer period of time, but I'm really pleased that I got into it through Governor Dreyfus, and I've been in since. So that's how it came around.
Let's see, let's talk about your term. You're an elected official. Your term is?
It's elected official. My term is 4 years. That has recently been changed. It was a 2-year term for many, many years, but it's on a 4-year term now, 4-year cycle.
It makes a lot of sense. And I know that you have, wow, there's just a lot of different angles to get it here, but let's start with some of the logistics. So one man, one woman, whoever the coroner is, couldn't be on call all the time. And I mean, you have to be ready to be able to assist in helping to find some answers, right? And so how does it work? You've got deputies in the county. Let's talk about the schedule, the deputies.
I do, yeah. It is literally a 24/7, 365 days a year job. We're on call. There's someone on call all the time. Death does not take a holiday, I've heard in some terms. So whether it be Christmas or weekends or at 3, 4 a.m., there's always someone on call. Generally, it's me. When I'm in the county, I'm on call pretty much 24/7. I do have 4 deputies. There's a chief deputy coroner and 3 deputies that work with me. They're all very, very part-time. But in my absence, as in the case of this taping, I have someone on call for me, so I'm not interrupted during this period, that can cover in case a call comes in during this period of time.
So did you train, I mean, how does the training work? How do the qualifications all fit?
Well, that becomes an interesting subject. In an elected position for coroner, it really just takes one more vote than the other guy, which has been a kind of a bad mark on coroners throughout the entire state, because there are coroners out there, obviously, that may not have been qualified. For me and for this office, I began as a paramedic and have medical training in that regard. Then once I became coroner, I went out and became board certified, nationally board certified by the American Board of Medical Legal Death Investigators.
Medical Legal Death Investigators.
Yep, ABMDI, Medical Legal Death Investigators, American Board of Medical Legal Death Investigators. So national criteria. All of our deputies, except for one now, is ABMDI certified, which is a requirement of me or my office, just because the knowledge base is required. And it helps out not only in the knowledge of how to investigate deaths, but it also aids in testifying. So if we go into a court of law and have to testify on a civil or criminal matter, it certainly helps to have the criteria behind you. Now, I'm sorry to say that's not always the case throughout the entire state of Wisconsin, and we're in the process now, our state association is in the process of attempting to develop new legislation so that there is minimum training criteria. And with the help of Amy Sue Vrewink, she has been really a help to us. She is penning the legislation and entering in the legislation. And I've been a prime player. I chair the legislative committee for the state organization. And we've been attempting to develop state standards, minimum training standards for coroner or medical examiners throughout the entire state. And hopefully in the next a year or so we'll have those standards on board so that everybody will at least have a minimum level of training.
This was interesting, even in my early days in this office, you know, where we were meeting, and you were talking about the fact that there wasn't under the coroner title, there hadn't been, you know, anything else for a core requirement or field of expertise to be in that role. And I thought, wow, that's truly something. But yet under the medical examiner pathway, there would have been, or there is, right? And
not necessarily. It's not required by statutes.
Okay.
But it certainly could be a criteria by the county in hiring that individual. A medical examiner is actually appointed as anybody would be hired in a county structure. A coroner is an elected official. Both have followed the same laws in the state. It's just that one is appointed medical examiner and the coroner is elected. And there, out of 72 counties in the state, the majority of them probably, I hate to throw out statistics, because, but over 50% are coroner's offices, and the others are medical examiner's offices in the state.
so I think when I remember back to our early days of talking, one of the things is your concern about the fact that the qualifications are really important, and that we had some choices in Portage County. You know, we could even have looked at whether or not a future design might be that we would have looked to appoint a medical examiner versus have an elected coroner. But then what I really loved was at the Public Safety Emergency Management Committee recently, when you were bringing up that you were working with your colleagues in the state and your network to be able to try at a different angle, and that just seemed to answer many concerns and questions. So it's a great initiative, it sounds like. Yeah, yeah. All right, so when you get the call, will you walk us through, what happens? Do you have to go to every scene? Do you?
Not necessarily.
Okay.
It all depends on the circumstances. Obviously, the office is meant to pick up on the suspicious or the criminal based events. We want to catch the homicides, and we want to make sure that everything is medically, legally done properly. So in case there's a civil liability or a criminal event, that we handle it properly. So we will take these steps of trying to determine whether this is trauma-related or potentially of medical legal nature, and then that will take a whole different avenue than a natural death of an elderly person at home that has a long history. Some of those may be able to be handled over the phone if they've been under a care of a physician or under a care of hospice, and have a long-known history, medical history, and then we can coordinate those fairly easily over the phone and pretty much be transparent to the family. Those cases that need a further investigation, we need to determine really a cause of death. Then we may have to actually go further and transport the individual into St. Michael's Hospital and do further studies, potentially all the way up to an autopsy, if that's the case. If it is of medical legal concern to us, homicide or questionable homicide or really an unknown as to what may be going on, then we will handle this forensically, meaning that criminal investigation of. And we have to transport these individuals down to Madison, where the forensic pathologists actually are. And they will do the full forensic autopsies for us and do the investigation as far as the autopsy is concerned. Then in concert with the law enforcement agency that's involved and the district attorney's office, we pull together the case to a point where we can come up and determine a cause, and then the manner, which may be homicide or suicide or whatever the circumstances may be. And then the case has been investigated fully, and we're prepared for anything that may come our way as far as civil or legal liabilities.
So where's your office located? Yeah, I heard you.
My office is within the Sheriff's Department. I have a little cubby hole they give me there to...
Of course, I know that part, but
Yes.
I wanted you to be able to tell everybody else.
Yeah.
But when you talk about going to the hospital, I think that's a key piece for everybody to understand.
Right, it is. My office where all the paperwork is done and so forth is in the Sheriff's Department. I'm within the detective unit over there. But a lot of the physical work obviously is done in St. Michael's Hospital and Ministry Medical Group have been extremely great partners with the county, because they offer these the facilities to us for nothing, and as a county service from their perspective. So I'm able to use their morgue, their coolers, and their facilities to go ahead with our business. There's some counties obviously that don't have that ability, and thus the county must then create their own morgues, create their own facilities to do this work in, which can be a pretty high expense for the county structure.
Yes, and I think this partnership is something that we wanted everybody to know about and to honor the fact that it's been going on for quite some time in a great way to help families, to help us get to answers sooner.
It has been. They've been a great, and including we use their laboratory facilities, and we will utilize their pathologist if the need arises, and their morgue facilities, and they have just been an awesome partner in sharing.
Excellent. All right, so let's talk about some of the greater concerns when it comes to the causes of death, because again, you're right there, and you're getting the first reports oftentimes.
Yeah.
Talk about that.
Well, we have concerns that do arise, and part of the coroner's office is to determine if there's any effect on the community as a whole. And so we look at deaths trying to determine if there's any infectious property that might be of a concern to our community, or do we have an increase in suicides that might be taking place and why that might be happening. We have suicide organizations out there that look at the statistics, and this office also tries to determine. So we look at waves and patterns that occur in death investigations. What's been happening recently, which has been troubling in the last few years, is the number of drug deaths that are occurring. Prescription drug overdose and drug deaths from illicit drugs, and heroin is making an impact into our county now. We began noticing a major increase about 4 or 5 years ago, and in working with, and these were primarily prescription drugs that were prescribed by physicians and either obtained through them under not legal reasons, or obtained illicitly by purchase from other individuals. And we do have people die from drug overdoses. They just don't realize that the impact that some of these drugs, or multiple drugs, we call it a polydrug overdose, where multiple drugs might be used. They just don't know the impact, and people are dying from that. We've been working with our healthcare community for the past 4 or 5 years, and our drug officers through the Portage County Sheriff's Department and Stevens Point Police Department, and I and this office have created a program. We've presented to physicians, dentists, pharmacists.
I know my pastor went. I mean, it was out in faith-based organizations that picked up on it and sent groups of people to go. So
we've been presenting this program, and we have had an impact. That along, physicians or the healthcare community are acutely aware now of the high potential of what's going on with these drugs. Now with the advent of medical healthcare records, and prescriptions can now be electronically written or sent. Pharmacists are very, very aware of it, so there's a great tracking that's going on, and I think we've had an impact on the availability of prescription drugs in our community. The problem now is those have become harder to obtain and are becoming more expensive, so what we now see is an influx of heroin into our community. We had 2 heroin deaths this year and 1 the year before, whereas for the longest time I've never had a heroin death prior to this. And I know with our EMS community and the law enforcement community, they're just seeing a tremendous amount of heroin abuse out there, and people are dying from it. And heroin is an ugly, ugly drug. It's highly addictive, not only illegal, but it's highly addictive, and it can be readily life-threatening too.
Oh, we know that alcohol and other drug abuse is a huge, complicated issue that is pervasive in our community. It's costing us all in multiple ways and means. What other leading causes of death? I know we have a couple other minutes, and I want to get to cremation just a little bit too, but what other causes of death are leading?
Suicides are always present in our community. We try, and I know our healthcare community and our
healthcare, the Health and Human Services Coalition,
and even through Ministry Medical Group, their psychiatric services really try hard to stem that. And so we keep an eye on that. Motor vehicle crashes have gone down over the years, which is great. We used to have a great number of those, but those are settling down. And then really what's up there a little bit more are falls in the elderly, where they fall and fracture a hip or injure themselves in some way and die from that. It becomes an accidental death. So that's a large component of deaths in Portage County also.
I know I have maybe 30 seconds left in the show, and one of the things I just want to make sure everybody understands is you play the role with cremation permits, so that's another piece, so making sure before cremation that you haven't destroyed evidence along the way, so that's another important piece. But in all of this, Scott, on behalf of the people of this county, we can't thank you enough. We know it's not an easy job. It's, I'm sure, a dirty job. It's a job that may make you lose sleeps every now and then, and we so appreciate what you do, and you do just a fine job. So
well, thank you very much. I appreciate that.
Yes, yes, yes. Next month on Portage County Matters, Dr. Mike Curtis from Ministry St. Michael's Hospital is going to join me along with a cardiac arrest survivor to talk about the CAST program, the cardiac arrest survival team effort that we have going on in Portage County to save lives. So we'll hope that you will join us. And again, thanks, Scott.